Hey, right, I didn't give you this one. So let's see if you remember what we talked about the other day. Okay. If your therapist tends to focus on issues of death, freedom, isolation, and meaninglessness, he or she would probably be classified as what type of therapist? Psychoanalytic, existential, gestalt, or client-centered? By the way, as I talk about all these therapists, I do recognize that they're all men, okay, in that way. But they're the first ones that did that. Actually, the field of psychology there are much more females in psychology now than men. Matter of fact, there are more females in college and graduate schools and on and on and on. That's there. But it's really the American Psychological Association probably has close to 65 or 66% of the people in there are females. So females have really dominated psychology in the last, let's say, 15, 20 years. But 40 years ago, when these people were writing, they weren't that around. So, all right, everybody got this one? Right out of your notes, isn't it? I mean, it came right off of one of the slides. You don't remember it, right? You get it, right? Still don't recognize you sometimes without your hat on. So, I get used to people wearing certain clothes all the time. So, not picking on you. All right, got it. All right, 78% is correct. Right, it's existential. That's what they talked about. They focused on death, freedom, isolation, and meaninglessness. That's basically what they talked about there. Okay? All right, just out of interest for you, this is just an opinion question like we've had. What do you believe is the best method for treating individuals, people who have like emotional issues? Do you think we should just put them on medication? Maybe just counseling. That's what we've been talking about, counseling. Counseling with medication, hospitalization or institutionalization, or just let the families take care of them. What do you think would be the best method? It's just an opinion that you have, because I want to make a point about this too before we get into the next section. I tell you what my answer is as you give your opinions. I think it depends, okay? And it depends on the issues. I think the more severe the issues are, like psychosis, schizophrenia, major depression, bipolar, I think medication first. I think that's the most important thing, because a lot of those, I think, are more issues in terms of brain chemistry that's there. I also think that people who have emotional issues, too much anxiety, mild depression, I think medication does help people. Let's see what you said before I wander off here. Yeah, most of you say counseling with medication, and I would agree with you with that. I think if you have any issues or concerns, I think the first place you go is to a counselor. And I'm going to promote the counseling center again here. Okay, I think that we've brought in counselors from the general community. If you ever wanted to talk to somebody to get that veil, okay, the cloud off of your eyes so you can see clearly, we do have counselors here we brought in who you can go see, and it doesn't cost you anything. By the way, it did cost you something because that was part of your student fees that are there. So if you wanted to, you can sit down and chat with them and make an appointment with them. In the website, there's an announcement in there that gives you the phone number and everything that's there. But I think the first thing is counseling. What happens a lot of times is a lot of people go to their general practitioners, okay, and then somebody may report, I just get all this anxiety, I can't settle down. And right away, most general practitioners say, well, I can give you some Xanax. I can give you some Valium. That'll help. And they put people on medication probably one too quickly. I think that most, and the better physicians will do this, they'll say, yeah, well, let me give you something to help you, but here's a card for somebody I'd also like you to go see and talk to. Okay? And I think that's probably more important. That's why I would agree with you that I think 2 and 3 are probably the best options that are there. What medication does, I think has helped people. I mean, it does help. But what it should do is, if you're too anxious, it should take some of the anxiety down, okay, so you can deal with issues. If you're very depressed, it should bring you back up and take the bottom out of the depression, and then you learn to help yourself. Remember I was talking with you about phobia of snakes and things like that? Well, I went through all that systematic desensitization. I didn't take any medication because I was able to get through it. But at any time, if that anxiety got too much for me and I couldn't go a next step, well, it might be good to take some Valium. Therefore, it would enable me to get through the next step. Okay? And I can say, oh, I did that successfully, and then they'd wean me off of it as I went through it. So it's an assistance that's there. Unless you're bipolar or unless that you have schizophrenia, then I think those are more illnesses of the brain and people should stay on their medication.
What if you have like anxiety and depression? Like do the medicines counteract it?
No, they don't. See, let me tell everybody what the question was. What if you have anxiety and depression? And that may seem odd, but that's not odd. Because what happens sometimes, your anxiety gets so great, see what I'm doing with my hands? It gets so great, but it exhausts you. And then all of a sudden you crash again. And there is a diagnosis called an adjustment disorder with anxiety and depression that's there. Some of the medications treat both. Some of what they call the SSRIs will treat both. That's there. Or what happens is that sometimes you take as needed an anxiety medication, okay, when the anxiety gets too high, and the antidepressant you take all the time. Because most of the antidepressants they have out now, they don't work like right away. You have to take it and it gradually builds up in your system. Okay? And then when there's other issues like anxiety, one might take an anti-anxiety to get you through a situation that's there. Okay? But that's not unusual that that's there. All right, I got off on that somewhere. Let me go back, and I'll come back to medication. Because let me talk about another way therapists do therapy, and that is through groups. There are individual therapy, all the ones I described, cognitive behavior, client-centered therapy, which was humanistic, all of those can be done one-on-one, okay? But there are other times that you may enter into a group counseling situation. That's where it's you and 4, 6, 8, 10 people get together, okay, within a group. Sometimes you have one therapist or no therapist. Now let me also say there are other groups that are out there that are called support groups. And the most famous support group is AA, Alcoholics Anonymous, or NA, Narcotics Anonymous. Those are not therapist-run groups. Those are people helping each other. People who've been alcoholic, or excuse me, one doesn't be alcoholic. They are alcoholic and are in the process of recovery. Got to get my words right there. And what those are non-therapist groups. They're support groups that we call. But these are real therapy groups where you sit down with other people. Psychotherapy conducted in a group setting to make therapeutic use of group dynamics. Maybe there's somebody in the group who has issues like you, but they're about 3 months down the road. Okay? They're a little bit ahead of you. Then maybe you can talk with them about how they got there in the process of getting there. They can work with you maybe as a mentor. Maybe there's somebody in that group who reminds you of the person in your life who you really don't like. Well, maybe with the therapist, you can learn to get along with that person or reduce some of the issues that are in there within the group itself. Group therapy is also less expensive because you're in there with more people that's there. Some groups are done with something specific in mind, like recovering alcoholics, or only for people who have anxiety, or children who grew up with alcoholic parents. Okay? So they're done maybe with a theme to it as well. Let me tell you about 3 distinct types of groups therapies. One is called psychodrama. And in psychodrama, what happens is that the therapy is done as if you're in a drama, like a theater presentation. This is fascinating to watch. A fellow by the name of Moreno, okay, was the one who developed it. Moreno was not a psychologist. Moreno was a off-Broadway, this was in New York City, we say he was like an acting coach. I think that's what they called him. Okay? And what he was doing was a type of coaching in terms of acting called method acting. And what he wanted to do is, when he would say, all right, what we're going to do right now, we're going to play a part, and this is a part of a woman who's very depressed, so I want all of you right now to think of a time in your life, by the way, don't do this, okay, when you've been really depressed, or things weren't going well, and if you've never been depressed, just think about somebody else who could be depressed and how bad they may feel, okay? How they may look, how they may feel, okay? What kind of energy would they have? And I want you to go there and be that person. Well, then people would do it, and he'd do a scene with them, and he'd say, oh, that was great. Boy, you were really there. That's great. Let's move on. Well, you know, sometimes people just can't move on that quickly because they get wrapped up in the role or actually in their own depression that's there. So Moreno was a nice guy, and he said, God, I can't leave these people like this. So he started doing therapy. And he did therapy in a theater, let's say, like this. And then he had 2 scenes up on stage. The 2 most popular ones he would do is one was a living room, and the other one was a dining room, okay? And then what he had was actually costumes that you could put on and wear. This was a big production. And he'd say, all right, who wants to be the first person today to work on something? All right, so somebody raises their hand. Well, come on down. What would you like to work on? Well, Thanksgiving is tomorrow, okay? And what I'd like to do is talk with you and with my family. Because, you know, every time I go back home and he says, all right, stop for a second. Let's do this, okay? Who here in this audience reminds you a little bit of who's going to be at your Thanksgiving table? Oh, my mom. All right, who kind of looks like your mom or reminds you of your mom? How about that person over there? Come on down. Now tell us about your mom a little bit so she can play the role of your mom. All right, come to the dining room table. Where does mom sit? All right, who else is there? My dad. All right, what about your dad? Come on down, Dad. Tell you about Dad. Who else is there? Grandma. All right, who's going to be Grandma? And they can put on costumes and whatever else. So they're all sitting there. So then Moreno would stand behind the girl and say, all right, well, what happens? Well, I know what's going to happen. We're sitting down for dinner, and my dad says right away, oh, look who's here, our big city girl, okay, who's a college student now in the big city of Dallas, came back to visit us. Isn't that cute, okay, that she's here? Okay, doesn't like living in our town anymore, does she? Okay, well, why does your dad say that? Okay, so the person would say it, and then the girl would say, well, you know, he's so controlling. All right, Dad, you need to be controlling now. All right, let's get back into this. So then Moreno would say, what would you really like to say to your dad? Well, I'd like to just tell him to go. Okay? Well, would you do that? No way, I'm not doing that. All right, well, don't do that. Let's think of another appropriate way of saying this. So Moreno works with her a little bit, and then the girl says, you know, Dad, every time I come home, I feel like I'm not wanted. You're telling me that, you know, you're insulting me when I come home. Oh, yeah? I'll tell you something about insults. I'll give you some insults if you dare say that to me. And then Mom speaks up and goes, no, let's not have a fight. It's Thanksgiving. Everybody needs to be nice and calm. Why do we always have to fight all the time? And then Moreno goes through this and then stops and tells the girl, well, maybe you should try this, and why do you think your dad is saying that, and trying to develop awareness. And then every once in a while, maybe the mom would stop, who's playing the mom, and say, I can't do this role anymore. Why can't you do this role anymore? Because it's just like my mother. She never stood up to my father. My father was always dominant. He always told everybody what to do. She never stood up for us. All right, let's stop. Come on over here to the living room. Okay. Now, we'd like to talk to your mom. Who in here looks like your mom? Come on down, Mom. Then another therapist would jump in and work with them. So what they wound up doing is what we called role playing. Okay? And with the role playing, what happened is that the girl would develop some insight into what was going on in the family dynamics, and 2, she would practice appropriate behavior as well. That's interesting stuff. I really don't know anybody in Dallas who does psychodrama. I do know that I've had other people in these classes say, oh, I've gone to that before, but it's not done as such a big thing. Sometimes in group therapy, you'll do what's called role playing. Okay, that's there. Okay, and you work on certain issues that are there as well. But it is done here in Dallas. Another one that's done in a group is called family therapy, and the group is the family. That's there. Now let me stop for a second and say family therapists have a different orientation, okay, to individual therapists. Family therapists believe that there's an identified patient within the family, someone who has issues, and by the way, usually it's a child, okay, that's there, who's acting out, and mom usually brings the child into therapy and says, this child has issues, fix this child. If she went to a family therapist, the therapist may say to that mom, well, I believe your son has different issues. He's gotten arrested 3 times. He obviously has issues. That's there. But you know what? What I find, he may not be the issue. Maybe the issue is the family system and what goes on within the family that creates this child to be the family scapegoat. Remember the other day when Lauren Montu was here and she did some of this stuff? She was trying to tell you about what goes on within families and how families, we learn roles in families. So the family therapists, what they do is they say, if the system is dysfunctional, then it's going to affect everybody in the family. And even though, I don't remember who was the hero child, who was, the good child and everything that was here, right? Okay? Even that person has problems, okay? So in the course of family therapy, you may do what's called family sculpturing, that's what they did, was family sculpturing. And then you may turn to the hero child and say, well, what is it like being the hero? Okay? And a lot of times the hero child says, you know what, it's a lot of pressure, okay? I have to be perfect all the time. Okay, and what happens sometimes to the hero child at Thanksgiving, okay, when the family is together, the hero child walks in, everybody goes, oh, you're here, you're going to college, you're so smart. Okay, I wish you would like him. Okay, oh, this is so great. But what winds up happening is that sometimes they're not doing as well as everybody thinks they are, and they start lying because they have to live up to be the hero child. So in family therapy, what we do is we don't treat the individual, okay, because they may be the family scapegoat. Every time something goes bad in the family, they blame that child, or that child is going to do something, okay? When the pressure in the family builds up, that child may unconsciously act out. So what happens, the pressure in the family all goes on them, and the family settles down. Mom and dad no longer argue with each other because now the child has an issue and they're joined together, and boom, all of a sudden there's no more family anxiety anymore. Doesn't that sound a little weird that that would happen? But I want you to think about it, and this would be fun to do tomorrow if you're with your families. Just sit back a little bit and watch. Are there certain roles that people have learned within families? And more importantly, what's your role? Are you the hero child that does everything right? And everybody looks up to you and says, wow, you do everything right. Okay? And you go, yeah. Okay? But there may be a lot of pressure on you. Are you the rebel child? The one that's always acting out, doing something different. Everybody's getting along well, and all of a sudden you say something at Thanksgiving, and everybody gets upset about that. Are you the rebel child? Are you the one, the scapegoat that gets blamed all the time? Are you the savior? Okay? Are you the one that says, no, let's stop arguing. Okay? Everybody just needs to get along. Are you that one who's the caretaker of the family to make sure everybody's okay? Mom and dad are having arguments. You get mom to the side and go, dad really loves you, but sometimes he has a hard time expressing it. But maybe you two need to talk a little bit more. Dad really wants to talk to me. Does he really? Yeah, he really does, Mom. Okay. Dad, Mom really loves you, and she really wants to talk to you, and you're trying to make peace that's there. So, by the way, there are hundreds of different roles that people can learn within families, okay? It's important for you, what the family therapists tell us to understand what role you may have played. And by the way, you might have 2 or 3 roles when you were growing up that's there. So what role did you play? Because the role that you play, and like what Lauren Montu was saying, is that role carries through in all of your relationships. So if you were the caretaker, the one who was rescuing people and taking care of people, that becomes an integral part of your personality. So you might be drawn to professions where you take care of people. Counseling, being a teacher, okay? Are you ready? A nurse. Some of you want to go into nursing, okay? Because you're a caretaker. And you do that well. That's there. Or maybe you don't have any aptitude for those positions, but you're a really good engineer, okay? Or a really good accountant. But when you go to your job, you're the one that's going to remember everybody's birthday. Let's have a cake for so-and-so. And you're still taking care of people in that way. Then, who are the people you marry? Okay, do you wind up marrying another rebel? Okay, well, sometimes it happens. As Lauren said, it's usually your first marriage. Okay, but then after a while, sometimes the rebel is going to look towards someone to save them and take care of them. So who does the caretaker marry? They're going to look for somebody who's in trouble. Okay, because they need to take care of somebody. Talk about an up and down relationship there, right? Because then the caretaker's always getting hurt all the time, trying to take care of a rebel in that way. So we start thinking about what roles people play, and in family therapy, we want to point those out and show people that, one, there are positive parts. There's a lot of positive parts to rebels because they're outspoken, okay? They think pretty clearly. They point out problems in families and things like that. But there are also downsides. So let's educate people and then reduce the tension within the family. If that happens, then you help the individual. A little different way of doing therapy. The next one is called group awareness training. And what these are when you go to a workshop or some type of training, okay, you become more aware of who you are. Okay? Some of you have done this with your church groups. You've gone away for a weekend and stuff, and I know it was probably religiously dominated, but they also wanted to get you to know you a little bit better. Has anyone ever done any ropes training? We have all these ropes, and you climb up these ropes and stuff? No? Or Outward Bound? You've done some of this stuff? What it is trying to get you to become more aware of your personality traits. Like if I asked you, are you a trusting person? Most people go, oh yeah. Well, let's see if you really are. So let's do an exercise. Let's blindfold you. Okay? Let's first pair you up with somebody you don't know, and then let's blindfold you and have that person walk you around and see if you can trust them. Or how about this one? Let's have you stand right here in the middle, and we're going to have a group of people stand around you. And when I ask you to, what I want you to do is just stand there, and I want you just to fall back. Don't worry about it. We'll catch you. Ready? Okay? Well, people who trust go, okay, and they fall back, right? People who don't trust are going to go, oh, you want me to fall back? Yeah, fall back. Now. Like now? Now. Okay, now. All right, here I go. And they look for the biggest person, okay, and they orientate their body, and then they do this leg, watch. And then they fall back. That's not too good, okay? So then the therapist would say, well, how come you didn't just let go? Well, I didn't feel like it. I don't know these people. Well, does that happen sometimes? Well, if I knew them, I'd trust them. I don't know that. Sometimes what goes on here like this may be a good indication to what you're about. I'm just here to build awareness, that's all. Ropes training. Sometimes you can have all these ropes, and by the way, most of the time they're safe, most of the time. They hook you up so they make sure you don't fall, but you can go up a good 2 or 3 stories high, okay, up on these ropes. Sometimes you can develop the ropes and get them set up that no one can get to the top by themselves. Let's say if I was doing a workshop with a sales team and teaching them about cooperation. What I might do is say, all right, I got myself $100. Everybody see, here's $100. $100 is to go up on the very, very top. Whoever gets to the top first gets the $100. How about that? Are we ready? Ready, everybody down below? Go. Okay, now, by the way, as they go up there, there's no way you can get to the top, okay, without help. That's the way it's set up. But Mr. Competition over here, okay, goes up as quick as he can and actually steps on other people's hands on the way up, okay? And then the therapist then says, is that what happens at work? You know, how'd you like your hand being stepped on? Oh, I didn't like it. Is that what he does? Yeah, he does that a lot, okay, at work. Well, no, I don't. Well, they just said you did. Let's think about that. And then he gets up halfway and he can't get any further and everybody else is catching up to him. Then you stop and say, well, what's going on here right now? Okay? And he's getting frustrated because he can't get there. And then it's like, well, maybe if you all, and can you imagine this? I mean, you're 20 feet up in the air, and the therapist then saying, well, maybe you need to talk to each other about how you can get to the top through cooperation. Okay? Well, I don't know. He doesn't cooperate. Well, you need to talk with him about that. Maybe we'll make this are you ready? A teachable moment, and we can learn about this. No. Okay? Interesting stuff. How would you like to climb a cliff? Okay, and go up, 60, 70 feet up. You're tied into things. You're not going to fall off. Okay, and let's see what happens if you can make it. And then as you go up, you get tired, you can't stop, you get scared, you get frustrated. And then the therapist who's climbing up next to you says to you, I know, but you need to keep going. Oh, I can't do this anymore. I'm just tired. Well, does this happen sometimes in life? That you get stuck sometimes, you can't push yourself anymore forward. When you get tired, well, just rest and then go. I don't know, I just want to get down. Is that what you do in life sometimes? When you have a goal, you let go? So what these do, that sounds very confrontational, doesn't it? I know it does, but you're trying to teach people something about themselves because we all have what? Defense mechanisms, okay? And sometimes you say, are you trustworthy? Oh, yeah. Well, let's put you in a situation and see if you really are. Just to build awareness, to give you information about yourself. If you ever get a chance to go on some of these are fascinating. I know some of the church groups do like marriage encounters and premarital weekends away to get to know your spouse better. And those are pretty interesting too, to find out more about you, your spouse, what you like and dislike. All right, let's talk about overall core features of psychotherapy. So if anybody ever was going into therapy, what would you expect? What happens in therapy? One, there should be a therapeutic alliance. You and the therapist are working together to help you to help yourself. As a practicing therapist, what I would say to people is, I'm here to help you to help yourself. I can't do it for you, but we can do this together. I am a facilitator. I am going to guide, direct, and make it easier for you to do this. Okay? But we need to do this together. And if we do this together, I need for you to be as honest as possible with me. What do you think about that? Sitting down with a total stranger and telling them about your issues and your problems and your deepest thoughts and fears? Pretty scary, right? But you know what? Sometimes it's easier to do it with a stranger than it is with someone you know. I call this the airplane phenomena. If you ever sit on an airplane next to somebody for 3 hours, okay, and all of a sudden they start telling you all about their life, and it's going like, good gosh, I don't know if I wanted to know all that. Sometimes it's easier to tell a stranger. As a therapist in this therapeutic alliance, the therapist should be as uncritical and as objective as possible. You get that? I mean, you do get to know the person, and you have a relationship with them, but they really need to be that way. I cannot do therapy with anybody who I know very well. I can't do it with my wife, my children, or my friends. Okay? One, if I did, I'd get my license taken away. Okay? And two, what would happen is that I can't be objective. Right? How can I be objective? My wife would tell me that I am the problem. Okay? So how can I be objective that way? So you have to be able to what? Be objective with people. That's part of that therapeutic alliance. One, therapy could be a protected setting for catharsis. Now, a catharsis is a Freudian term that means emotional release. It's a place for an emotional release. Sometimes people don't talk about issues and it builds up inside them. And in therapy, it's a place to release all that anger, that pain, that hurt, that sadness that's there, to get it out. Because too many times it builds up in people, and that's what also develops the cloud that's there. So you want to be able to release this stuff in therapy. Also can offer an explanation or a rationale for why there are issues. Some people need to know. They don't even get why there's an issue or problem. So you try to help them and say, this is the reason why this came about. And for a lot of people, is once they get that thought, then they can develop plans to change those issues. You might also provide clients with a new perspective about themselves and a chance to practice new behaviors. Let's have you bring out something and transform your personality and bring some different things out, and then practice that within the session. Maybe you're not very assertive and you're trying to be more assertive in your life. Well, let's practice that within the therapeutic setting. Let's do it over and over and over again so it becomes a conditioned behavior. Makes it a little more easier as you get out into the world. All right, let's switch a little bit and talk about medical therapies. I started talking about that before. Drug therapies, medications for anxiety, medications for depression, medications for psychosis. Okay? What all of these are doing, as I mentioned before, is balancing off the neurochemicals that might be an imbalance that's there. Once again, we talked about this as maybe if someone is depressed, a lot of the new SSRIs, the new antidepressants, just take the bottom out. You don't take a pill and all of a sudden feel happy. Oh, I feel so happy. No, it takes the bottom out and then allows you maybe to work on the issues. Or takes the anxiety that's so overwhelming and reduces it so that you can work on some different things. Do you remember I showed you that film about Jerry, who is the schizophrenic? And I don't know if you heard, but in the beginning, it said Jerry is on this and this and this and this. For some people like Jerry, he may take an antipsychotic, but he also may take an anti-anxiety. Because what we find out is the antipsychotic works real well until it gets into an overwhelming anxiety-producing situation, and then that doesn't work that well. So then we need to put them on an anti-anxiety to make sure the antipsychotic works as well. What winds up happening sometimes, they get on too much medication. Good.
Do the medicines ever affect each other?
Yeah, they do. They can. And a good psychiatrist, because in the state of Texas, the only people who prescribe medication, okay, these psychotropic drugs as they're called, are medical doctors. Psychologists can't do that. Counselors can't prescribe. So a good psychiatrist has to be able to balance that out, okay? It's not easy. It's really not easy. If anyone has ever been on medication, I tell you what, I told you this at the very beginning of the semester. Okay, we don't know about your brain and how it works. It's a trial that's there. It's like, here, take this. Let's see what happens. Okay, oops, it's making you too sleepy. Let's reduce that a little bit. Whoops, not working that well. Let's increase it. Well, you're getting sleepy after you take it. Well, let's take it at night instead of in the morning. So it's trial and error with this. And then when you get into life situations, sometimes neurochemicals are being released and they upset that. So it's trial and error.
You said in the state of Texas, so is there still states where psychologists?
There are some states, and don't ask me where, okay, because I don't remember, where psychologists are able to prescribe medications. Yeah. And matter of fact, in the state of Texas, the psychologists are trying to get permission to do that. Electroconvulsive therapy, shock treatment. Ever hear about this? An old movie called One Flew Over the Cuckoo's Nest. At the very end of it, they gave Jack Nicholson shock treatment. Okay, electrodes around your neck. They restrain you, lay you down, restrain you, tie you down, restrain you. Electrodes around this area usually give you a muscle relaxer, because if they don't, they're putting electrical current into your brain. If they don't, what happens? Your body starts flopping around like this. Usually eliminates all memories that you had during the day. You just lose all those memories, the way it affects it. But the way it works, remember your brain is electrical chemical? what it does is increase the level of neurochemicals in your brain. It changes it. And this can work for certain people. In the 1960s and 70s, it was very, very popular. Okay? But it sounds so cruel, doesn't it? It sounds like something out of Frankenstein. Shocking people. And it got into disfavor in the 90s, but it started coming back again. Okay, because what they've done, they've able to pinpoint the brain a little bit more, and it does seem to work for some people. They also are able to implant electrodes in certain parts of your brain, which then give you an intermittent, okay, quick little impulses that are there that seem also to kind of work for people. Okay? The newest one they have out now is called transcranial magnetic stimulation, TMS. Again, it's magnets that are there that, again, change the neurochemicals in the brain. The more and more we get to know about the brain and where areas of the brain, okay, may produce depression or schizophrenia or whatever, the more we may be able to go in and, ooh, this is going to be weird, okay, do transplants maybe. Maybe take healthy cells, put it in cells that aren't so healthy, if that's what depression is about, or schizophrenia, right? We really don't know exactly, but maybe in the future they might be doing stuff like that. So these are what's called medical treatments. Here are some different medications that this is right out of your book, commonly prescribed psychiatric drugs, the anxiety drugs, antidepressant drugs, and antipsychotic drugs, and some of the names of those. By the way, a lot of these drugs have side effects, okay, and that's the downside of these. They have side effects. Some of the antidepressants reduce your sex drive. Some of the antidepressants will increase weight gain. Okay, some of them will make you extremely sleepy. Some of them will make you very anxious. Okay, there are side effects to all of these. So you have to, again, that's why the psychiatrist works with people. So see this, how does it work? If there's a side effect, isn't there? And they work with you with these. This is how they work. Okay, the antipsychotic drug, what it does, it gets into the brain. Remember this one? I showed you this. It gets into the brain and changes the chemicals in the brain. You're taking a medication which changes the neurochemicals in the brain. It either blocks the uptake of something or it's going to increase the availability of certain medications, of certain neurochemicals. I don't know. Tell me, if I had a psychological issue, I would consult a therapist, would you? No, I'm biased. I hope you all say yes. Okay? But I tell you why, let's get this one. The reason why I put this one on here is basically because we still live in a society where there's a real anti-therapy situation where we think, only crazy people need to go, and I'm not crazy. Oh, I'm not going to have somebody tell me what to do. Well, therapists don't tell you what to do, okay? Or, I can handle this. I can do this on my own. And most of you say, yes, you would. And I'm glad you would. Because all this is just sitting down with another person who's going to help you to help yourself. That's all it is. You don't have to be crazy. You don't have to. It's just going to a consultant. Some of you hire when you work out. You hire somebody to work out, to help you work out, or a financial advisor and things like that. That's what these people are. They're consultants for you to try to help you to help yourself. The best therapy method for me would be which one? Remember we talked about all these? Remember I said certain therapies are good for certain people, certain therapies are good, they're better for certain issues? Which one would you want to do? Psychoanalysis, humanistic, existential, gestalt, behavioral, cognitive, medical, group, or a combination of some of these? This is also a little test for you because you have to remember what these were like, what they mean. So you all excited? One more week of school after this? Huh? Yay. Actually, a lot of you are just worn down, right? So let's get through it. Got it? Come on. So combination, a humanistic, right? A lot of people like that one as well. Group therapy, maybe. Different for different people. You know what? Who are the main people, when we look at mental health, who are the main people out there who can help other people? Not the therapists of the world. You know who it is? You. Right? When your friends and family members have issues, do they right away call up a counselor? No. They come talk to you. And some of you, by the way, already have these skills. Basic counseling skills. If your friends come to you and they want to talk to you, I hope you do this for them. I hope you have active listening skills. You can sit and listen to the person. How do you listen to them? Don't interrupt them. Don't lecture to them. Use what Carl Rogers did was restatement and reflection. Oh, what are you saying? You're saying that, what did he say to you? He said that? Oh, really? How'd you feel? Yeah, I'd be angry too. Mm-hmm. Yeah, God, yeah, what a jerk. Uh-huh. Yeah. That's all you're doing. You're looking at them, what, one-on-one? Active listening skills. If you want to be a good parent, active listening skills. You want a good relationship? Active listening skills. You want to be a good manager? Active listening skills. Many people don't do that because I like to talk all the time, okay? But let somebody talk. Remember, sometimes all they have to do is say things out loud, and sometimes they figure it out when they hear themselves say it out loud. Help people clarify the problem. Sometimes people don't even know what the issue is. All they know, they're upset. Well, let's help people clarify the problem. 3, let somebody feel. I know us guys, we don't like it when people feel. Okay? Well, let them feel. Okay? Let them go ahead and just, I'm upset. Let people be upset. We don't like being around people who cry and are upset. It's kind of like, well, sometimes that's okay. Just let them feel. Let people feel. Try to avoid giving advice, because advice comes from you. All right? Most therapists, if you ask a therapist, well, what should I do? Most therapists are going to say, I don't know, I'm not you. But we can discuss what some different options are. Well, that's what you want to do with your friends. Well, what should I do? I don't know. I can't tell you what to do. But let's discuss some different options. Let's think of different options, what you could do, and weigh the pros and cons to it. You know what happens when you tell somebody, and they go and do it, and it doesn't work? Then they come back and say, well, you told me to do it, and it didn't work. It's all your fault. No. Don't tell them. And if you have to tell them, say, all right, I'll tell you what I would do, but I'm not you. And don't come back and tell me it's my fault, because I didn't tell you to do this. Hey, accept the person's frame of reference. What's upsetting to somebody else may not be upsetting to you. 14-year-old girl goes to her mother and says, well, I'm so upset. Bobby broke up with me. I don't know if I can live another day. Bobby, I just loved him so much, and Bobby broke up with me. And Mom says, who's Bobby? I met him last week at the mall, and I'm in love with him. And Mom says, you met him last week at the mall, and you're upset? Let me tell you about being upset. I've been divorced 3 times. I'll tell you about misery that's there. No, she's 14 years old. Don't you remember when your hearts were broken at 14? No, your hearts were never broken, okay? Mine was, okay? But remember that. Accept someone's frame of reference. Can you imagine a therapist saying to somebody, you think that's a problem? The person who was just here before you, they really have issues. No, you got to accept someone's what? Frame of reference. Reflect their thoughts and feelings. You want to restate back, this is what you said, this is how you feel. What that does is keep somebody talking. You can say, really? Silence is okay. You can use silence, it's okay. Sit there and just be quiet. Let somebody else, you don't have to always jump in and say something. Sometimes silence is a notion of reflection, and they'll say something. Try to ask open-ended questions. Don't say closed questions like, how did you feel? Did you feel, no, not how did you feel, did you feel sad? Were you angry? No, you want to ask questions like, say something like, well, tell me more about that. How did you feel? That's more open-ended. How did you feel? How did that make you feel? What happened when he said? Because you want to get people talking. Otherwise, if you say, were you sad? Were you angry? When you say that, the person just says, yes, no, yes, no. But you want to get them talking. Open-ended questions. You want to maintain confidentiality. There's a problem right there. All right? Your best friend tells you something, boy, it was pretty juicy. And then you go tell your other best friend and say, you're my best friend, don't tell anybody. Oh, okay. Then they tell somebody else. And no, if you're my best friend, and if I say to you, don't tell anybody else, I want to make sure you don't tell anybody else. Therapist, this is the bottom line foundation of therapy is confidentiality. What you tell them, they are not allowed to tell anybody else. I don't think I sat here and ever said, oh, Susie, I saw Susie yesterday, and let me tell you what she said. No. Okay? The only time if I ever said anything is when you have permission to say something. You don't tell anybody about this. If a therapist does, they can get their license taken away, and you should sue them very quickly. Okay? Because whatever you say in that office stays there. Unless you give them permission to do that. Unless you give permission to do that. Or, here's the other one, where a therapist can confide. If you are a danger to yourself or someone else, okay, then they can call the police, parents, or whoever else. Okay? If you're a danger to yourself or someone else. Okay? Otherwise, we maintain confidentiality. If someone has issues and problems, you need to remind them that when to get over issues and problems, it's a process. It takes a while. There's that friend of yours, you get the phone ringing at 11 o'clock at night or 1 o'clock in the morning, you look at the caller ID, it's her again, or it's him again. It's kind of like, God, she still hasn't gotten over him. It's been 3 months and she's still upset and she's calling, I really don't want to talk to her, okay? Because she's wearing you out. Okay? Well, after a while, sometimes you need to tell those people, you know what, I care about you and love you. We've talked about this for a while. You still haven't gotten over it. Maybe you need to learn that it's a process. It takes a while. And maybe it's time for you to talk to somebody else. What do you mean somebody else? You think I'm crazy? No, I don't think you're crazy. But you keep talking to me. And I try to help you, but it's just not working. You're stuck in this. Maybe we can go maybe I can help you find somebody else. Okay? Because we want people to be action-oriented. Too many times people get stuck, and they get stuck, and they get stuck, and they can't get out of it. No, we want to help people get out of things. So what do you think? Do you think therapy can work? I tell you the simple answer to this, it does work if you let it work. Sounds like an old joke, right? The first step, by the way, of change is being aware that there's issues to begin with, that's there. So can it work? And you say, yeah, it can work. Again, if you let it work, that's there. Let's say you want to go see somebody and talk to somebody. How do you find these people? Well, once again, there's the counseling center here. You can go talk to those people. You might want to talk to a religious leader if you want some type of religious counseling. You can go talk to a lawyer. They can give you counseling that's there. You can go to a mental health professional. Okay, you might see not in the phone books though or online. What you want to do is be able to find somebody you trust. I'd talk to your friends. Maybe your friends have somebody they went to. I've been here for 35 years. Okay, I don't think I'll be here for another 35 years, but in a couple of years, if you need to see somebody, give me a call. No, people don't call anymore. Send me an email. Okay, and I'll give you names of 2 or 3 people to go talk to. Okay, and what you want to do now that you know something about therapy, ask them questions. These are my issues. These are my problems. Can you help me with this? What kind of therapy do you use? Okay, be an educated consumer. Be an educated consumer and ask these people some of these issues. You want to get personal with these people? Ask them, have you ever had a problem like this? Okay, now they have a right to say, that's personal, I'm not going to answer that. Okay, but, that's part of the whole thing that's there. You don't want to go to somebody who's going through a divorce and you're going through a divorce. Right? I mean, they may have issues there themselves. Okay, and they should be able to say, you know what, I can't help you with that. I have personal issues with this, let me get you to somebody. because this is a very personal issue, but all of these can help you. Whoops, let me skip that one. I'll come back to that one. Let me give you some questions, because this is the end of the chapter. Some questions to get some points on. So those 3 people that left aren't getting points. All right. Core features of psychotherapy are what? We just went over this. Therapeutic alliance, protective setting for catharsis, often an explanation or rationale for issues. Well, all of the above are correct. All right, we all got this one? This should be an easy one. Right. All of the above are correct, right? Each and every one of these are correct, right off of that overhead that we just did. Okay, want another one? Yeah. Sometimes they show up on your test too, right? How about this one? This is an interesting one. Hannah's therapist uses a directive approach in which he draws attention to Hannah's posture, voice, and gestures in order to help her become more aware of her perceptions and feelings in the here and now. Hannah's therapist appears to be what type of therapist? Cognitive therapist, Gestalt therapist, client-centered therapist, or behavioral therapist? There's some key words there, isn't there? What's the most important key word? Here and now, right? That should automatically bring you right to the answer. So I'm going to say this, I guess not for the last time. I may do this next week too. When you take multiple choice questions, you're always looking for key phrases. And then when you study, you're trying to study using key phrases, key words. All right, everybody got that one? Yes? Send in your answers. You guys got that now? Okay. And the correct answer is, right, Gestalt therapist, right? Stay in the here and now. Fritz Perls, who was looking at body language, that was there. All right? So, hang with me a little bit here. Let me just end this. And what I want to do is I want